That's great. Okay, so hello. I think today I just have two students, but it's totally fine. Okay, so without wasting any time, let's start with our today's topic. So today we are just left with a few topics, and we will discover STIs related scenarios and a few other related to your medicine scenarios. So let's start from the beginning. First of all, we are going to discuss the STIs approach, like whenever you got a scenario related to sexual transmitted infection, how you are going to approach that scenario. So first of all, you have to keep this thing in mind. These scenarios can come in different forms. For example, it could be the first initial visit of the patient, or it could be a follow-up visit in which you are supposed to explain the results, test results to the patient. And second thing is, a patient with STI can present in two ways. He or she can have an abnormal discharge, or they can present with a kind of lesion in the private parts. So in both kind of situations, you need to be prepared for these scenarios. So first of all, you need to know that there are few things that you are supposed not to miss when you are approaching the sexual transmitted infection related scenarios. So first of all, when the patient comes, you are going to start with taking the history. For example, if the presenting complaint of the patient is, doctor, I am having abnormal discharge, then you are supposed to take the history of that discharge. You have to keep, like Dr. Hamid has asked you to remember the word topa. So in that case, you have to recall the same word, but you have to take it in different meanings. For example, for the T, you will ask the patient, when did it start? Or you can ask, for how long have you had this? And then for O here, take the overall picture of the discharge. For example, what questions are going to ask? Okay, so Miss Linda, what is the color of it? How much is it? Is it teaspoon or tablespoon? Like related to quantity. Is it smelly? And if she says that it is smelly, what kind of smell it is? Does it happens all the times? And then ask about, is it getting worse over the period of time, or is it staying the same? And have you noticed anything that makes it worse or makes it better? But if the presenting complaint of the patient is, doctor, I have a lesion on my private parts, then you are supposed to ask about the lesion questions that we discussed in the dermatology section. What is that? You have to read that word, light, dark type of colors, merge as smooth and plain. For L is, where is it? Like, where is the lesion, or where is your swelling? How many lesions do you notice? For how long have you had this lesion? Is it growing under the skin or at the top of the skin? Is it then is it the same color as of your skin, or what is the color of it? And then ask about the margins as well. Is it regular or irregular? What's the size of it? Have you noticed any change in the size of that or not? And then ask about the associated symptoms. For example, in the associated symptoms, what comes is, you have to, whenever there is a lesion, there is a rash on a body, or there is any kind of discharge from the private parts, you need to ask about, do you have any lesion in the mouth? Do you have fever? And then ask about the symptoms related to urinary tract infection, because whenever a patient has STI, he or she can you know have urinary tract infection as well. So you have to ask this, do you have pain, or do you feel burning sensation when you pass the urine? And then ask for the systemic symptoms if you think that these are related to that. For example, you can ask just main symptoms. For example, do you have cough? Do you have fever? Do you have loose stools? And have you noticed any lumps and bumps anywhere on your body? And then the red flags comes, in which you will ask about the weight loss particularly. And then after that, you need to complete the sexual history. In these sections, sexual history is really very important. You have to take the detailed history. Well, there are two school of thoughts. A few people says that whenever you are going to start with the sexual history, take permission, signpost the patient. There is no need of taking any permission. Otherwise, you are going to make it a bit awkward, and also you will waste your time. When you're going to take the sexual history, just signpost. Okay, Linda, so I need to ask a few questions related to your sexual history. Are you sexually active? Are you in a stable relationship? She will say no. And okay, so how many partners do you have? And what route of sex you prefer? And is your partner male or female? This question is also very important. Is your partner male or female, and then ask if she or he mentions that my partner is, for example, he is lesbian or gay, you need to ask about, do you use toys? And then ask, do you practice safe sex? By that I means, do you use condoms? If the patient is female, then ask about the menstrual and the contraception history. Why this history is important here? Because if you're suspecting that she or he is sexually active, and they for sure they have sexual transmitted infection because they are not using any condom or any other safe method, so that means she might be at the chance of getting pregnant. So you have to rule out. And then will comes the other rest of the history. Ask about, do you have any previous medical problem? Are you taking any kind of medications, any painkiller? And okay, are you allergic to anything, any particular thing that you are allergic from? Do you have any disease that runs in the family? Okay, do you have, is this the first time that you have these symptoms, or you have had this before? Okay, and then ask about the smoking history, very important here. Do you smoke? Do you drink alcohol? All right, and then ask about the travel history. Here the travel history is very important. Have you recently traveled abroad? Okay, and for what purpose did you travel? You need to ask that as well. What is your occupation? Whom do you live with? What do you do for living? Okay, and then ask about same. Do you need to ask about the concerns of the patient? Do you have any particular concern, or if there is anything you're worried about? Both, you can use one of these sentences to just ask if the patient has particular concern. Okay, and then comes the examination and observation. So for this same, you will say the same. Well, Linda, I need to take your blood pressure, pulse, temperature, and respiratory rate, and also I need to do your abdominal examination and your vaginal examination, and we'll also do a general physical examination, so just not to miss anything. And I'll be maintaining your privacy, and there will be a chaperone with us. Okay, so you have to mention all these points. There is no need to say, I need to examine your front passage. The people are well aware of what vagina is, so you have to mention that: abdominal examination, vaginal examination, and general physical examination. And in the history section, if the patient mentions that, doctor, yes, I do have problem when I pass the urine, then you need to mention that I also need to run a test, that is urine dipstick. As I believe that you all are aware that in OET, here the T covers the bedside test, like the test that you can order on the bedside and the results you can get on the bedside. Okay. But if the patient haven't mentioned any symptom of UTI, there is no need to mention urine dipstick. And then comes the management. People here, again, if you will mention the examination part, then examiner will give you the examination history, examination symptoms. Otherwise, they will not give them to them on your, for example, on their own, they won't mention that. So you have to mention examination, because that is very important. And also, if you will mention vaginal examination, then they will give you some finding of any kind of discharge or any lien. Otherwise, they won't mention anything. They won't help you in this thing. Then the next thing that I want to mention here, as I have already mentioned all the questions that we will cover in PMMA, HO family, DASA, TOLAI, but you have to keep one thing in mind. You don't need to ask all the questions. Just ask the relative questions to save your time, because you have to cover the management part as well. To score high, that is very important for you to divide the time equally. Like when I appeared in the PLAB exam, Alhamdulillah, the stations I passed almost in 5 to 6 exam, say 5 to 6, or you can say 7 to 8, I guess, stations. My score was 12 out of 12. And in the other ones, the my score was 9 out of 12. So because the total you know the score for the for each station is 12, so I got full marks in a lot of stations. The only thing was, I always managed time properly. I gave proper time to the management part. I have covered all the points related to the management part. I didn't waste a lot of time on the history taking. I didn't ask irrelevant questions. So that's the way, that's the actually main key to pass the PLAB exam easily and with good grade. Okay, so in the management part, you people must know that whenever the patient comes and you are suspecting the patient has STI, you have to explain to the patient, you have to signpost the patient. Well, for example, you will first explain the findings. Well, on examination, I have found this, and this. And based on the examination findings and based on what you have told me, I suspect that it might be some simple infection, but it might be some sexual transmitted infection, because as you have mentioned that you do not practice safe sex and you have been in relation with multiple people, so that might be the one of the reason that you might have sexual transmitted infection. For this, what I need to do is I need to refer you to the genitourinary clinic and you will be seen within 24 hours. So in the management for STI, there is a rule that you have to mention that you are going to refer the patient to genitourinary clinic and they will be seen within 24 hours. And then afterwards, you have to ask the patient, is that okay for you? If he or she says, okay, then explain what the people in the genitourinary clinic will do. You have to explain that. Well, what they're going to do with you is, Linda, they will ask you a few questions, they will do some examinations, and they will do some blood tests and swab tests to screen you for sexual transmitted infections. Then if they confirm the infection, they will start you accordingly. And then the management or the medicine you will mention according to your scenario. But if the patient, the one more thing, you also have to mention the patient that once you are confirmed that you have STI, they might ask you for the details of the people you have been in physical contact with within the last 6 months. Because as you are at the risk of STI and STI can easily spread to the other people. So to make sure for their good health, we need to call them and we need to screen them for sexual transmitted infection. If at this stage the patient says, oh no, you are going to tell them about my details, you have to reassure them, well, I can see that must be difficult for you, you must be worried about that, but Linda, there is no need to worry about that, because what we are going to do is we can get help from the patient notification program. It is basically a service in which you will just give a few details of the patient and or your partners, and they will be contacted without without telling your details to them, and your details would be kept confidential, but we need to call them for screening for STIs. And then if or she has some active partner as well, then you have to mention to the patient. And one more thing, Linda, you have to ask your partner to come. Does your partner has any symptoms? All right, then you need to bring them here, or you need to take them with you to the genitourinary clinic for testing. If she says, you have to then ask them, is that okay for you? Are you okay with that? If she or he says, no, doctor, I can't, that's in this way, I'm going to break the marriage, I can't do that, then you have to mention that, well, here is the thing, Linda. Let me explain myself in other words. As the sexual transmitted infection, if it is not treated, it can cause complications. So even if you do not tell your partner on your own, we have, being a medical professional or being a doctor, we have to inform your partner. And for this, we will ask the patient notification program to inform your partner. Even if they have been notified by the patient notification program, still the conversation will bring up between you and your wife. So it's always better to inform them on your own. Okay. All right. So these are the main points that you need to cover. But if in a scenario, the patient says, I don't want to go to the genitourinary clinic, just treat me here, then for sure you can treat them in the GP as well. Okay. So you need to keep this thing in mind as well. And once, for example, if you are in genitourinary clinic, then you have to tell for the follow-up, tell that as you have STI, I'm going to start you on this medicine and you need to take it properly, and avoid sexual intercourse until you have completed the treatment. And we are going to have a follow-up with you after 1 week to do a cure test. It is basically a test to confirm that you are infection free. So all these points, I have just give you a rough picture that all these points you can cover in different scenarios. Okay. So first of all, history. And the history, what you are going to do is you are going to take the history according to the presenting complaint. If it is a lesion, ask the history of the lesion first, as light and dark colors merge plain and smooth by using that acronym. And then ask about the discharge as well. If they mention, yes, I do have a discharge as well along with the lesion, then ask a few questions of the discharge, and then take the rest of the history, like associated symptoms, detail sexual history. If she is if the patient is your female, ask about the menstrual history, contraception history, and then the rest of the history as well. And also one more thing, whenever the patient has STI and you are taking the history, do ask about the recreational drug history as well, because these people are at the risk of that as well. Okay. All right. And regarding the management part, as I have already mentioned, you have to mention that I have confirmed this because of you have mentioned in the history that you do this and this, like signpost, justify your answer in front of the patient, and then mention that you are going to refer them to the genital urinary clinic and they will be seen within 24 hours. And they, what will they do? Then explain that in a row. Okay. Okay. So a few more points that you always need to cover in your in these scenarios, otherwise if you miss that you won't get good marks. Like the thing is, referring to the genital urinary clinic and then mentioning that they will be seen within 24 hours, and then mentioning about that they have to inform their partners, or also mention in the that if they can't do that on their own, you can get help from patient notification program. And also about the follow-up. And also, whenever you start the patient on some medicine, you have to tell them there are a few things that you need to care of. Please do not do any sexual intercourse while you are on this medicine. And even if you do it, please use condoms. And afterwards, when you are get treated fully, you again at the risk of getting these infections. So always try to have a safe sex. Okay, so let's discuss the scenarios, people. If you people have any query up till now, please let me know. Okay, so I think you all are fine with that. Okay, the scenario is you refer to in GP, a 26-year-old female has come for a follow-up. Other info, she came to go 2 weeks ago with dysuria and she has been prescribed trimethoprim for 1 week. Then 1 week ago, she again come to the practice with dysuria, and this time she has been prescribed nitrofurantoin. A urine culture was done and which showed leukocytes in high number. Today, she has come back for a follow-up, talk to the patient and address the concerns. Now, the patient info is she had burning sensation while passing the urine for the past 2 weeks and came to the GP and was prescribed 2 different antibiotics, still experiencing a burning sensation. Married for 2 years, normally fit and well, use injectable contraceptions. Now, and also this scenario can comes in two ways. She can say, yes, I have clear discharge for 2 weeks, or she might not have any discharge. Okay. And the question she would ask is, why am I still having burning sensation when passing the urine? Okay. So your scenario is people, it is a follow-up approach. So you have to paraphrase the patient. You are going to paraphrase it properly. Start with your introduction and then paraphrase it. But I can see, Linda, that you have visited us before and we have started your antibiotics. And then after that, the antibiotic was changed to a different one. And how are you feeling now? Then ask this, how are you feeling now? Then she will say, oh, doctor, I'm not getting fine. I'm not feeling well. Then ask, just let me ask a few more questions. What symptoms did you have previously? Okay. And have they done some investigations? Okay. And have they started on which medication? Were you taking them regularly? All right. And then take the rest of the history, because in your mind, it should be clicked that the patient was given 2 types of antibiotics and it didn't work. So she might be having some kind of STI. So you have to take the same history, ask about have you noticed any discharge recently from your private parts? She might say yes, or she might say no. Okay. If she says yes, ask the same questions. What kind of discharge it is? Smell, color, for how long, getting worse, and the rest. And if she says no, ask about the lesion, ask about the associated symptom. Even if she says there is no other symptom, ask about the sexual history in detail, and also about the menstrual history, the contraception history, and cover the rest of the year history. And then mention the examination. Here you need to examine the patient. You need to mention that you need to examine the patient, because she might be having lesion or she might be having discharges she might not be aware of. So you have to mention that. Okay, so then you need to explain the management. Well, Linda, if the patient you always have to keep one thing in mind, people. Whenever the patient is sitting in front of you, she will be giving you both verbal and non-verbal clues. But the non-verbal clues are, she might look anxious, she might be worried, she might be anxious, and she would be just pressing her hands. So if the patient or the actor is giving you these symptoms, you have to pick them, you have to mention them. For example, my patient is very curious. Yes, I'm getting worried, I'm getting panic attack, I'm not getting better, doctor, what you people are doing. You have to relax her. Well, I can see, Linda, I can see that must be very difficult for you to cope with these symptoms with your daily life. I can totally understand your condition. Well, let me explain this thing for you. Well, based on what you have told me, it seems like it is highly unlikely that you have waterworks infection, basically UTI. In other words, we say it waterworks infection, as you have told me that you have vaginal discharge as well, and you practice unsafe sex. Unsafe sex, I am suspecting it might be an sexual transmitted infection, because it can also present in the same way. That might be the reason that why the antibiotics are not working and you still have the symptoms. So what I need to do is I need to refer you to the genitourinary clinic, and you will be seen within 24 hours. Is that okay for you? You need to ask that question. Is that okay for you? The patient will respond. Then what they are going to do is they will do examination, they will do some blood tests, and they might take some swabs to check for any sexual transmitted infection. If it is confirmed, they will start on the treatment. And the doctor, does your partner has any symptoms? Like the doctor will ask, you will ask one more question, does your partner has any symptoms? Patient says no. Then you should say, if the STI is confirmed, then they might ask you to bring your partner as well to screen him as well. And then the rest of your questions will go on according to the patient concerns or questions, and then you are going to offer the leaflets. Okay, so the next scenario is gonorrhea, people. All right, one more thing. One more, always keep one thing in mind. Don't sound scripted. If in the history, when you were taking, the patient mentions that, for example, doctor, I am a smoker, then you need to take the history of smoking as well. For how long do you smoke? How much do you smoke? Okay. And then when you have time in the management, do cover the smoking part as well. And Linda, smoking is not good for the health. It is injurious to the health. So I would recommend you to quit smoking. What do you think about that? Okay. If the patient is alcoholic and he or she is drinking above the recommended amount, you have to mention that as well. Well, Linda, you are actually, I'm afraid that you are drinking more than that is allowed to do so. By drinking a lot of alcohol, it can be injurious to health. So I would recommend you to reduce your drinking. What do you think about that? She might say, okay, I will think about it. And you can say, okay, I can refer you to the Alcohol Anonymous groups. There are sport groups that will help you to reduce your drinking habit. Okay. So, okay. So the next scenario is people gonorrhea. Okay, so you are in genitourinary clinic. A 35-year-old male has been on antibiotics for gonorrhea. The nurse have talked to them about contacting tracing, but he declined. Talk to the patient and convince him about contact tracing and address his concern. So from this scenario, you can get a clear-cut idea that patient has already been diagnosed with STI. He has already been counseled about STI, and he has already been started on the medicine. So what's your task is you have to convince him about the contract tracing. Okay, so this scenario would go one-to-one approach. Like, that's not, you're not going to just talk on your own. You have to talk with the patient, you have to deal with the patient, you have to conversate like one-to-one. So you can say it would be a kind of dialogue exchange scenario. So what the patient info is, he came yesterday because of the discharge from the front vessel. The discharge started 2 weeks ago when you were in the Greece on the holiday, started 2 days after having sexual intercourse with a prostitute in the Greece. When you came back to the UK, you had sexual intercourse with your wife. And after that, discharge became worse. You don't usually use any protection with your wife, didn't use condoms while in Greece. Questions. Why do you want to inform my wife? And okay, so he will say, how are you going to do that? Like, if the doctor says to you, like, this is the line for the patient, that if the doctor asks you or mention that patient notification program, you have to ask them how you're going to do that. And if I don't give my permission, are you still going to tell my wife? Okay, so how you're going to proceed, people? You are in genitourinary clinic, first of all. Secondly, this is a follow-up scenario. So you have to paraphrase. Well, I understand that you have been diagnosed with gonorrhea and you have been started on treatment for that. And I have already been told that you were asked to inform your wife, but you are not happy with that. Is there any particular reason why you do not want to inform your wife? So when people, this scenario is very kind of sensitive scenario. Why? Because already your colleague, the nurse, has already talked to him, but he is resistant in disclosing this information. The patient might be very furious, or they might be very sensitive right now or emotional right now. So your tone must be ideally empathetic. You must show empathy with your words and with your expressions towards the patient. Lean, sit properly. We might share with you a few videos that how you're supposed to sit when you are dealing with such scenarios. Like, lean a bit forward, your hands must be on your thighs, okay? And when you're speaking, you should give some kind of expressions on your face, okay? And your tone must be um his name might be John. Okay, so John, I understand that you have been diagnosed with gonorrhea and you have been started on the treatment for that. Am I right? And I have also been told that you were asked about to inform your wife about, but you are not happy with that. Can I ask, is there any particular reason why you don't want to inform your wife? Okay, so that's where you're going to say this, because this is a sensitive kind of scenario. Then he will say, my marriage will crash if you inform my wife, then you have to tell them. But you have been all right. I can see that must be very difficult for you. That must be a very difficult situation for you. But you have been told so far about your condition. Can I ask a few questions so I can have a better understanding? Then take history, like ask the 4 questions from the previous visit. Because why are you doing this? We're just doing this so that you can have a few clues, or you can have a strong base to convince the patient to inform his wife. They asked, what symptoms were you having? What investigations did they done? What you've been told? Okay. And then ask about, now, as you have taken the medicine, are you taking it now regularly? Now, do you have any symptoms? What kind of symptoms do you have at the present? Take the sexual history in detail and the rest of the history. And when you are taking the sexual history here, people ask about, when you came back to your country, have you had sexual intercourse with your wife, and was it an unprotected sexual intercourse? Okay, does your wife has any symptoms right now? Okay, and then the management part, explain. Well, you have been diagnosed with sexual transmitted infection called gonorrhea. It is transmitted via unprotected sexual intercourse. It is likely that you transmit the infection to your wife. So it is important for your wife to come and get tested. If your wife is not tested and treated, she may develop some complications like infection of the womb or infertility, or she is at the risk of ectopic pregnancy. So that is really important for your wife to know. If you do not want to do that, what we can do is we can get help from the patient notification program. They will inform your wife and to come and get tested without disclosing where we got the information from. But when she gets diagnosed with STI, she might still bring this conversation to you. So it's always better to inform your wife yourself. What do you think about that? You need to, and also he might argue or he might say something, then you will take your conversation on according to his lines. For example, he might say that I don't want to, I can't do this. Then you have to mention, well, I can see that is difficult for you, but this is very important for your wife to know. Otherwise, that can be life threatening for your wife. She might not be able to become mother in the future if she is not tested and treated properly. And then you have to mention that you need to give the contact of the other people as well with whom you have been sexually active within the last 6 months. It can be done through patient notification program, and your details won't be shared. You can catch STI again. So avoid the unsafe sex. Do not have sex until you and your wife are clear of infection, and then open the leaflets and follow up after 1 week for the cure test. Okay. So one more thing, people here, if the patient is not convinced, you have to continue on exchanging the dialogues. Even if at some point he says, I'm not going to do anything or this, and I'm not going to allow you to do this, then you have to mention, well, I'm sorry to say, But if you do not do this on your own, and even if you do not allow us, that is our obligation to do so. So for your wife's health, as we will inform her through the patient notification program. That is how we are supposed to do in this situation. I hope you are getting my point. Yeah, or I hope you are understanding this. Okay. Then comes the next scenario. It's the Syphilis people. The same approach, everything same. Now let me read the scenario for you. You are referred to the GP surgery. A 28-year-old has come for the follow-up. He had visited Wellman Clinic last week to be tested for STI. Results are as follows: HIV negative, hepatitis negative, TPHA positive, chlamydia, gonorrhea negative. Talk to the patient, address the concerns, explain the results. So the patient info: you are gay and have male partners. A few weeks ago had unprotected sex at the party, have all kind of sex, and you do not have a regular partner. Are you sure it is syphilis? These are the questions patient will ask. Is it curable? So the same approach you will have paraphrase it, that we have done a few tests. Now I believe you are here to get the reports. Has somebody explained the result? Then ask that, let me ask a few quick questions before explaining the result. And again, people, same 4 questions. Then your history here must be focused. Why? Because you have already done tests and your results are in your hand, and according to the results, the patient has syphilis. So you have to ask the symptoms of syphilis. Ask for the symptoms of syphilis. Do you have any lesion on the private part? Do you have any discharge? Have you noticed any lumps and bumps in your body? Have you had any fever, headache, or flu-like symptoms? Have you noticed any hair loss? Because all these symptoms can be present in syphilis, so you have to ask them. And then take the rest of the history, all the other questions: sexual history, PMMA, HO family, desatoli, everything. And then will come your OET, your examination part. You need to do the examination of the private parts, general physical examination, mention the urine dipstick if the patient says I have some kind of burning sensation. Okay. And the management would be the same. Okay. So here, one more thing. If the patient mentions that he has a lesion, or even if he says I don't have the lesion, you still need to mention the private part examination. I'll show you how syphilis look like. If you will mention the examination, and if the patient actually has the lesion, they will give you this picture. The examiner will give you this kind of picture. As you can see, a single lesion, there would be no discharge, it would be looking red, and it would be having a kind of irregular border. Okay. So the management is, whenever you are going to tell about the results, you always start with the good news. Well, as we did some tests and the test results are negative for HIV, hepatitis, chlamydia, and gonorrhea, but it is positive for syphilis. Syphilis is a sexual transmitted infection, and if it is not treated, it can cause serious and potentially life-threatening problems. And then take a pause, let the patient let the information sink in, and then say, I'm going to refer you to the genitourinary clinic, and you will be seen within 24 hours, and they will start you on an antibiotic. And you need to inform your partner, as it is STI, and without treatment it can cause complication. If the patient has multiple partners, or same, talk about the contact tracing by using the patient notification program. Patient might say, is it treatable, is it curable? Mention that it is curable, and then mention you will need to come back to the clinic 6 to 12 weeks after starting the treatment to be restarted. And please do not have sex until you and your partners have finished the treatment and tests have shown treatment has worked. Practice safe sex afterwards, as you can catch STI again. And he might say, ask that, is there any complication of syphilis? You have to mention, well, yes, Linda, there are a few complications associated with it, like it can affect your heart, your brain. If not treated, it can be life-threatening. And then offer the leaflets. Okay. One more thing, people, here, for example, in any kind of scenario, if the patient says, okay, you are saying that I might have STI, if it is confirmed that I have STI and I don't have multiple partners, then do you think my husband is cheating on me? Then how you are going to answer that? Let me give you a scenario. For example, the patient, the female, was having in contact with almost 3 to 4 sexual partners 6 months back, and for the last 6 months she is only sexually active with her husband. And now she is asking you, doctor, what do you think, is my husband cheating on me? So how you're going to answer that question? Dr. Naveed, Please unmute yourself and answer this question. Hello, Dr. Naveed, please unmute yourself.
Hello.
Yes, Dr. Naveed.
Okay.
Okay.
I would like to say that like this. I appreciate your question. For this question, I would like to say you that your partner should come to us, and we will get him tested. Either he has sexually infection or not. Am I right?
But doctor, my question is different. I'm asking you, is he cheating on me?
Um, uh, I'm really sorry to say you that he's cheating on you or not. It is not confirmed until we perform some investigations regarding this form of question like that.
Doctor, please try to understand and explain this to me because that if he is cheating on me, I'm not going to live with him anymore. I'm going to break up my relationship. Please tell me, doctor. It's a request. Please tell me. I'm getting panic attack. I don't know what's happening. How can he do this to me?
It is a really difficult situation to tell you that either he's doing any is it if either he is cheating on you or not, either he has multiple sexual partners or not. For that, it is not yet confirmed. It is better for him to come to us, and we will perform. We would like to perform further tests on him. Is that not enough to say like that?
Okay, Dr. Naveed, just let me ask from someone else, Dr. Zainab. So how you're going to address that concern, Dr. Zainab? Thank you, Dr. Naveed. Dr. Zainab, unmute yourself and please explain how you're going to address that part. Okay, so
Hello.
Hello. So doctor, do you think my husband is cheating on me?
Um, uh, I'm so sorry that you are feeling this way and you are so disturbed about it right now, Linda. But that is something that I think you and your husband should talk about, and he should be the one to let you know if he's doing it or not. I'm not in the position to tell you or if he's doing or not that or not.
Okay. So people, you both have covered the main points. Like you people are not sure that whether she got this from her husband or not, and she might discuss this with the husband. But you can explain this thing in a better way. For example, just to avoid any awkward situation, you can say, well, Linda, first of all, I can see that you are worried. I can totally understand that must be very difficult situation for you. But let me tell you one thing. As you have mentioned that you have been in a sexual contact with multiple partners 6 months back. So there is a possibility that you might get that infection from the partners previously, because in a lot of situations the infection might get the patient might be asymptomatic while having infection in their body or while having bug in their body. But on the other case, there is a possibility that you might get this infection from your husband. But right now, for this, we need to refer you to genitourinary clinic for further testing. Okay. So that's why we are just going to avoid the rough situation, or you can say we are just going to avoid the awkward situation. So whatever the patient has told you in the previous situation, just use these points to answer your query, or to answer the patient query, just to avoid the awkward situation. So how you're going to address this concern? Signpost it. Well, as Linda, you have mentioned that you have been in the sexual relationship with the multiple partners 6 months back. Well, there is a chance that you might get infection previously. On the other hand, there is an equal chances that you might get this infection from your husband. Right now, we are not sure about that. So for this, we are referring you to the genitourinary clinic. You and your husband would be tested there, and you people can discuss it between you. Right now, I cannot comment on this situation, or right now I can't give you any such kind of statement. I think you are understanding me, or are you getting me? Okay, Zainab and Dr. Nabil. So the next thing is, let's move forward. Okay, so this is how the syphilis lesion looks like. Okay, so the next is HIV follow-up case. The same scenario. If anybody wants to practice, people, anybody, almost the same situation. You are referred to in GP surgery. 25-year-old man has made an appointment to see you. He was diagnosed with HIV 1 week back. So he has already been diagnosed and he has been referred to the genitourinary clinic. He has an appointment to the genital urinary clinic next week. Talk to the patient and address his concerns. So the patient's concerns are actually, should I inform my wife? Can you help me tell my wife, can I have children with the HIV? Is there any chance that I could have transmitted HIV to my wife? So anybody wants to practice? Zainab, Dr. Barbara, Dr. Naveed, anybody? Hello? Anybody wants to practice, or should I just discuss it on my own? I think no one is interested. Okay. So people, how you're going to, how you're going to proceed in this scenario, the same, you have to paraphrase it. Same way. I understand that you have came to the practice last week and was diagnosed with HIV. And I understand that you have been referred to the genital urinary clinic. Is there anything you would like to discuss today? And your tone must be very empathic towards the patient because he has HIV and he might be very emotionally disturbed. So ask few more questions. What symptoms were you having? What investigations they have performed? Have you started you on some kind of medication? Are you taking your medications regularly? Then ask about the rest of the questions, like the same. But ask in a few questions about the presenting complaint that she had previously. Ask the sexual history. Ask about the any symptoms present in the partner. Ask about the PMMA family, like cover the rest of the history, and then say, well, I would advise you. Well, I can see same again. Give the patient hope, like not a false hope, but give some kind of statement that will suit the patient. Well, I can understand that you are very concerned about your wife and you're very anxious about the whole scenario. That must be very difficult for you. But I would advise you to inform your wife because she needs to come and get tested and started on the treatment. Then the patient will exchange the dialogues. Can you help me tell my wife? Okay, so I would suggest you to have a discussion with your wife. But if it is difficult for you to discuss with your wife, we can invite her for testing. But unfortunately, this will not avoid the discussion of you being HIV positive with your wife. Patient, can I have a children? Doctor, for sure, yes, you can have a children, but you have to complete the treatment. Is there any chance I could have transmitted HIV to my wife? Well, unfortunately, John, as you have unprotected sexual intercourse with your wife, there is a risk that you could have transmitted it to her. How did I get it? Well, it is a sexual transmitted infection. There are multiple routes of transmission. For example, via IV drug use, blood transfusions, unprotected sex, tattoos, needle sharing, and in your case, most likely you got the infection is from the person you had unprotected sex in Thailand. So, do I need to inform my employers? Well, you don't have to unless you have an agreement or through your job. Or there is a risk of transmission. So you need to just inform the medical insurance company and then offer the leaflets, and that's it. The scenario was very simple. Now the next scenario is suspected case in which you are just suspecting HIV, you are not sure. So how this going to be, the scenario going to be is, you are referred to the GP surgery. 30-year-old has come for the follow-up. He had visited GP surgery 2 weeks ago. Take focus history, assess patient, and discuss management. The patient visited GP before with a viral illness, cough, running nose, sneezing, sore throat, was told the symptoms will resolve and was asked to come for the follow-up. But he developed the swelling in the groin. He's married and his partner is a female. 4 weeks ago, went to the Thailand, had sexual intercourse with the male prostitute. After returning from Thailand, had unprotected sex with his wife. Usually do not practice safe sex, otherwise fit and well, not on any medication. Now the questions are, will I need to bring my wife for testing? What do you think is wrong? So here, don't sound scripted. Even if by reading the scenario you know that this is the HIV scenario, please don't sound scripted, otherwise you're not going to pass the station. So start on the scratch, like start from the scratch, like you don't know what's going on. You have to ask the question. So just 1 second. So okay. So you have to paraphrase it. Well, I can see that you have visited before. How are you doing now? Okay. And then ask about what symptoms. Patient will say, well, I'm not fine. I'm not doing well. I'm still having the symptoms. Then ask the 4 questions. What symptoms were you having? What treatment they offered? What they told you? And how are you doing now? And then as the patient will say, now I have developed the new symptom, I'm having swelling on in my groins, then you have to, then this will click in your mind that it might be TB or HIV. Then you have to ask about these symptoms, ask about the systemic and do the systemic inquiry. Do you have fever, cough, shortness of breath? Do you have loose stools? Do you have night sweats? Do you have any headache? Do you have any discharge or because when the patient has these symptoms and he has some bumps in her body, lumps and bumps in his or her body, the two diagnosis most of the times comes in the mind, that is the TB and the HIV. So in the TB, the patient will have the typical picture of cough, of the dry cough, and the history would be chronic, and the patient would have night sweats, weight loss. Okay, and the HIV also presents in the same way, but there will be some additional symptoms that she might be having a lean or some kind of discharge, and you will reach the proper, you will reach the proper diagnosis by taking the rest of the history. Otherwise, you might be get confused between the two. So you have to ask the detailed history, do the systemic inquiry like fever, cough, shortness of breath, any loose stools, any headache, any discharge or burning sensation while passing the urine. And do you have any discharge from your private parts? Have you noticed any lumps and bumps in your body anywhere? And have you noticed any weight loss? And do you have any lesion on any private parts? Okay. And then ask the rest of the history, same sexual history, PMMA, HF family, desatoli, everything, any previous medical problem. It's ask each and every question and then do the examination. When you will mention the examination, they will give you then the proper 612 line disconnected. No, okay. Then they will give you the findings. So you have to mention, well, I need to take your blood pressure, pulse, temperature, and respiratory rate, Linda, and also I need to do your chest examination. I'll be doing a general physical examination, and also I'll be checking for any glands enlargement throughout your body. I'll be maintaining your privacy, and there'll be a chaperone with us, okay? And again, if the patient has mentioned that I have burning sensation, then mention that I need to do a urine dipstick test as well. Then the management. Okay, so whenever you are talking about some sensitive issue and you are going to say something sensitive, but still you are not sure yourself, you always have to use a suspected cancer approach. You all must be well aware of that approach, suspected cancer approach. Like, what is it? From what you have told me and from my examination findings, since you have flu-like illnesses and your infection isn't resolving, and on examination, I found the swollen glands on your body, I'm suspecting that it could be some simple infection, but it could be something serious. And that is HIV infection. As you have told me that you had unprotected sexual intercourse in that island and developed the symptoms afterwards. Okay, then let the information sink in. So what is the suspected cancer approaches? First of all, I am going to mention that the symptoms you are having, the cause of it might be something very simple, but on the other hand, it can be something very serious, because some serious illnesses can also present in this way. So I'm suspecting that it might be some simple infection, but it could be HIV infection, as you have mentioned that you have this and this. So what am I using? Am I using here? I am using the, you can say, a broad spectrum kind of approach. Like I'm telling this, the possible causes would be as simple as this, but it could be as worst as this. And why I am thinking that it is can be a worse thing, as you have told me this and this. So this is the signposting, and you are also justifying your answer in front of the patient. And then you have to mention that what am I going to do is I'm going to refer you to the genitourinary clinic, and you will be seen within 24 hours. They will ask you a few questions, they will do some investigation, and they will test you for HIV. But in an unfortunate situation, if you are confirmed that you have HIV, you need to inform your wife. She also needs to come and get tested. Unfortunately, HIV is not curable, but there are treatments available, and it will affect your life in some way. But people with HIV can have a near normal life. Okay, so I'm going to refer you to the genitourinary clinic, and you will see same, and then offer the leaflet. If the patient asks further questions, answer the questions according to the to what question they ask. For example, they can ask. will I be able to become a father? You can mention yes, you will be able to become a father, because but before that you have to complete the treatment properly. But before that, the diagnosis need to be confirmed, and they will start you on the treatment, and once you complete the treatment, you will be able to become a father. Okay, so all the possible questions that the patient can ask in STI related scenarios, I have covered all of them, people. Okay, so always keep your mind open, keep your eyes open, keep your ear open, so you can handle all kind of situations. Okay, so the next scenario is genital warts. Very simple. Same, it is an STI, and the patient will be having symptoms, and you are in effort to in GP, and he made an urgent appointment. Talk to him, address the concerns. Patient info: there is a lesion, irregular shape, twin number, no discharge, no itchy, no pain, brown in color, no okay. Otherwise, well, perform unprotected sex, has multiple sexual partners, do all routes of sex, bisexual, alcoholic, do not smoke. Questions: will you maintain my privacy? Is it curable? That's it. So people, you will ask same. So in this scenario, the patient has presented with the lesion. Take the history of the lesion. Where is the lesion? How many lesions are there? What is the color of it? Is it growing under the skin? Is it growing over the skin? How is its margin? Is there any discharge or any bleeding coming out of it? Is it itchy? And is it getting bigger in size? Okay, and then ask the rest of the questions: any discharge, any fever, and then the rest, like sexual history. And if the patient is female, ask about the pregnancy history, menstrual history, contraception history. If he's male, then ask the rest of the queries, like smoking, alcohol, recreational drugs, and and travel history, everything. And then the management. Again, explain. Based on what you have told me and based on the examination, it seems like you have a condition called the genital warts, which is a sexual transmitted infection. As you have been practicing safe sex, people, one thing here you have to learn that whenever you are going to explain a diagnosis, this is the very ideal way to explain the diagnosis, that whenever you are going to give this diagnosis to the patient, always like use the clues, mention the clues that have made you to go for this diagnosis. For example, I'm going to give the patient that you have STI because you have told me that you did this. So whenever you are giving the diagnosis, always mention the points that have made you to go towards this diagnosis, because in this way you are going to justifying your patient. You are going to believe them. You are going to make them believe you. Okay, so you have this is an ideal way to explain the diagnosis. So genital warts are commonly a sexual transmitted infection passed on by the vaginal or anal sex, sharing the sex toys, and rarely by oral sex. Genital warts are small, fleshy growths, bumps, or you can say the skin changes that appear or on or around the genital or anal area. For this, I need to refer you to the genitourinary clinic. They might do some examination, will do further tests to screen for STIs. You need to inform your partner as well for the testing. If you cannot do it, we can get help from the patient notification program. But you are not going to tell in the way I told you. First of all, you have to mention that this is the diagnosis. Patient might ask, give a few seconds for the patient to ask the question, then explain what it is, then explain that you also need to inform your partner. And if they say that I won't, then mention that you can get help from the patient notification program. And then mention, so let me discuss the treatment options with you. The type of treatment you will be offered depends upon how the warts look like and where they are. They might offer you cream or liquid to apply, or surgery. They can be offered you can be offered freezing treatments as well. And it may take weeks or months for the treatments to work, and the warts may come back. In some people, the treatment does not work. So there is no cure, unfortunately, for the genital warts, but it's possible for your body to fight the virus over the time. So you have to mention this point is very important here. And there are few don'ts that you have to do. Please avoid perfume, soap, shower gel, or bath products during treatment, because these can irritate your skin. Do not smoke, and because many treatment for genital warts work better if you do not smoke. Do not have vaginal, anal, or oral sex until the warts have gone. But if you do have sex, always use condom. Now the patient question would be, did I get it from the toilet seat? No, you cannot get it from the toilet seat, kissing, or towels, and then offer the leaflets. That's it. Okay, so people, these were all the questions related to STIs. So I hope I have cleared all the questions to you, and these all are the points that they can ask you in the sexual transmitted infection related scenario. So these are you might get an idea that these are not difficult at all. You just have to have cover a few areas. For example, take the history. Do not miss sexual transmit. Do not miss the sexual history. Do not miss the examination part, otherwise you might not get the findings. And when you are mentioning the management, always mention the genital urinary clinic, but please do look on the scenario that either you are already in the genital urinary clinic, because if you are already in the genital urinary clinic, you are not going to refer them to the genital urinary clinic. That is very clear. And then mention about that we are going to explain that what we are going to do is, or what the people in the genital urinary clinic are going to do this, they will do this on you, they will do this for you, and what you are supposed to do is do not do sexual intercourse, and if you do after that, please always do safe sex, as you can get it again. And mention that you have to bring your partner for testing, and you have to give the details if you have been in relationship with multiple partners within the last 6 months, and mention the patient notification program, because by doing this you are getting good marks, going to get good marks. Okay, so we are just left with 3 more scenarios. So the GB syndrome, this scenario is related to your medicine. So you are referred to the GP surgery. A 45-year-old presented with a weakness. She had an upper respiratory tract infection 2 weeks ago. No antibiotics has been prescribed, and the infection has been resolved. Assess the patient, discuss the initial management with the patient. Now, the patient information: you have presented with the weakness. You had viral illness 3 weeks ago, and which gave you the symptoms of sneezing, coughing, fever, sore throat. For the past week, you have developed weakness on both of your legs, and in the sorry, and in the last few days you have developed weakness. You are finding it very, very difficult. You work as a taxi driver. You came to the hospital today driving. It has been difficult for you to brake or press on the clutch. Your mother is at the work. She works as an admin in the hospital. There is no past medical history, no regular medications, no allergies. Question: what is wrong with me? What will you do for me? Can I call my mom? What test will you do in the hospital? Why do I need to go to the hospital right now? So the patient has presented here with what? Weakness. So even if you got the idea that it is GBS, do not sound scripted. Always start from the scratch. Ask, how can I help you? She will mention that weakness. To ask, where is the weakness? And then when she mentions the weakness is in my leg or whatever area, you have to ask, what do you mean by weakness? Because she might be unable to, are you unable to move your leg, or are you having weakness while moving the leg? Like, for example, if the patient is totally unable to move the leg, or she is just having, she is able to move the leg but with difficulty. So you have to be very clear. You have to ask, what do you mean by weakness? And then ask, do you have anything else? Then there should be DDs in your mind. What DDs should be in your mind? If patient presents with a weakness, what could it be? It could be MS, multiple sclerosis. So you have to mention, has this happened before? Do you have any visual problems? Ask about the stroke. Do you have any slurring of speech? Ask about the myasthenia gravis. Do you feel like weakness gets worse as the time passes over the day? Then ask about the GPS. Do you have flu recently? Do you have any recent diarrhea? And then the red flags. Have you lost any weight recently? And then cover the rest of the history, just the relevant questions, people. Please do not ask the irrelevant questions. Do you have any previous medical problem? Are you taking any medication? Are you allergic to anything? Have you been hospitalized before? And then ask about, do you smoke? Do you drink alcohol? And what do you do for living? Okay, here the living question is very important, because as he has mentioned that I'm a taxi driver, because once you know that he's a taxi driver, you have to inform him, please do not drive. Okay, and then cover OET. You have to mention that, well, I need to do neurological examination of your legs, arms, and face, and also will do general physical examination. I'll be maintaining your privacy, and there'll be a chaperone with us. No need to do other tests. And then management. Explain. From what you have told me and from examination, I believe that you have a condition called GB syndrome, Guillain-Barré syndrome. It is basically a very rare and serious condition that affects the nerves. It mainly affects the feet, hands, and limbs and causing problem. It is thought to be caused by a problem with the immune system. What actually happens is, normally the body's natural defense against the illnesses, and normally it attacks the germs only. But in the people with Guillain-Barré syndrome, something goes wrong and it mistakenly attacks the nerves. And in your case, it seems like you have developed flu and your immune system has started attacking your own body. Are you following me? Then she will ask how you are going to treat it. So it can be treated and most people will eventually make a full recovery. Although it can be occasionally life-threatening, we need to send you immediate basis to the hospital. That is very important point here. GB syndrome, immediately refer to the hospital. Then ask, is that okay? If at this point the patient might say, no, I can't go, ask why. If they might say that I have a children's look after, I can't go, what you can say is, do you have any other person you can call right now? If she says no, then you can say, well, what we can do is we can arrange a temporary accommodation for your child. Is that fine for you right now? What do you think about this then? Okay, so in all the ways you have to accommodate your patient. Then ask, do you have any someone to drive you there? If not, I can arrange an accommodation to take you there. In the hospital, they will take history, they will admit you, and the few investigations will be carried out, like routine blood test, blood cultures, urine complete examination, your lung function test, and some special test, that is nerve conduction studies. After confirmation, they might offer your treatment made from donated blood, that will bring your immune system under control, or a plasma exchange where a machine is used to filter your blood to remove the harmful substances. They will offer you painkiller, and they might give you some treatment, for example the sport body functions like machines to help with the breathing or feeding if needed, and as it can affect your muscles severely. So the patient might ask, now what am I going to do and why you are sending me right now? So you have to mention, because this condition can be potentially lethal. So that's why I am sending you. Just a second. Okay, so that's why I'm sending you. Okay. So then you have to mention that however, most people with GB syndrome will recover from most of their symptoms within 6 to 12 months. But however, around 1 in 5 people are left with long-term problems. However, the therapies are available. For example, physiotherapy, occupational therapy, and may help you recover and cope with any lasting difficulties. Do you want to ask anything? And then ask, wish you a speedy recovery. That's it. And one more thing you have to mention, that you can't drive. You have to inform. Hello? You have to inform DVLA. Okay, so you cannot drive. You have to mention that you cannot drive. You have to inform DVLA. Okay, and then wish her a speedy recovery. That's it. Now the next question is sore throat. You people have already covered the sore throat scenarios, I guess. The same thing, the patient will present with a sore throat, but you have to rule out. You are not going to give the direct diagnosis of tonsillitis. You have to rule out the other things. So your effort in GP. 40-year-old presented with sore throat, assess and discuss management. Patient info: sore throat for the last 3 days, runny nose, difficulty in swallowing, feeling feverish. Taking simvastatin, allergic to penicillin, and what antibiotics will you give me? This is the question. So there are a few things that you won't miss here, because in the management, in this scenario, in the management, that is very important for you to know, are you going to start the antibiotics, or do you need to start the patient or antibiotics? And if you are going to start him on antibiotics, which antibiotic? Okay, because she is already taking simvastatin. So you will introduce yourself, use the grip approach, ask for the presenting complaint OPA, like for how long, when did it started, sudden in onset, gradual in onset, getting worse, okay, and is it staying the same, is it getting worse, and is there anything that is making it worse or making it better? Then ask for the anything else, like does she has any fever, any cough? If she has fever, cough, is it productive or non-productive? If it is productive, how much sputum is she bringing? What is the color of it? What is the amount of it? You have to ask these questions if the cough is productive. Then comes the DDs. So for tonsillitis, same questions: fever, cough, sneezing, and do you have pain on swelling? For glandular fever, because you have to rule out the glandular fever as well, because you might need to start on penicillin. So you have to ask this, like, ampicillin, same. So you have to ask that, do you have any rash? Have you noticed any neck swelling? Have you had any procedures done on the throat? Do you overuse your voice? Have you had any trauma? And are you taking any medications like steroids and statins? Because sometimes these drugs do affect the throat. And then the red flags comes like, have you recently lost any weight, and have you noticed any lumps and bumps in your body? And then covers the rest of the history, just the relevant questions. Don't ask too much questions. Here the allergy questions is very important. Allergy questions and the previous she is taking medication. Then mention the examination. Once you will mention the examination, they might give you this picture. So the in the management, first of all, you need to explain the patient that based on you have told me, I believe you have tonsillitis. It is basically inflammation of the glands present in your throat. Usually we give insulin, but I understand that you are allergic to penicillin. And also, so we need to give you an alternative medicine and clarithromycin for 5 to 7 days. But this medicine cannot be taken with the medicine you are already taking to control your cholesterol levels. So we need to stop it temporarily, and you will feel better after 48 hours. And you can take paracetamol if you have fever. And then give advice to the patient. Please drink plenty of fluids. Don't drink too hot or too cold drinks. Do salt water gargling, and please take rest. Okay. And then if you develop here, you have to safety net for meningitis, because any infection of the throat can goes to the brain. So if you develop any headache or any shyness from the light, please call 999 or come to the emergency department on urgent basis. Offer the leaflets and follow up. If it does not get better within 3 days, then come back after 3 days. Otherwise, follow up in 1 week's time. Now, so there is a criteria, people. The tonsillitis can come like it could be viral or bacterial. So by using this criteria, you are going to differentiate that either I need to start on antibiotic or not. This is the very important part of the management. So what is the criteria is Center's criteria. The acronym is PAIN. Pay for pyrexia. Temperature should be 38 degrees or above. There should be cervical adenopathy. There should be inflamed tonsil, plus on examination there should be pus, and there should be no cough. For all the points, you are going to score 1 for each point. If the total is 2 or above, it is bacterial tonsillitis, and you need to start the patient on antibiotic. Okay. So if it is above 2, sorry, it is above 2, not 2. If it is above 2, you need to start the patient on antibiotic. Okay. Okay. So the last scenario is hemetemesis. So you are referred to in the emergency department. A 32-year-old present with the vomiting blood. Blood pressure is this, and this. Take the focus history, discuss the differentials with the patient, and inform him of your next management plan. Patient info. Okay, so you have been vomiting dark colored bloods in the last 3 hours. You had vomited twice, once before coming to the hospital, once in the hospital. The amount was about 3 cups full. Abdominal pain started after the vomiting. Suddenly, you drink 1 bottle of wine every day, smoke 15 cigarettes. You have been taking ibuprofen and smoke 15 cigarettes per day. You are taking diclofenac and aspirin as well. You are feeling dizzy. There is no blood in your stool. You take ibuprofen for hangovers due to alcohol, and you have no color change in the stool. Question: what is wrong with me? What are you going to do for me? Will I go home today? What has caused this? When the doctor tells you about the endoscopy, you ask, will it be painful? And then the examiner's prompt that if you will mention the examination and the observation, he will give you these findings, that there is a tenderness in the epigastrium, and rest of the findings is normal, and BP is also on the lower side. So approach same. Now the patient is vomiting. Okay. However, even if it is she is vomiting blood, you have to ask about the vomiting questions first. Like you already know that the questions for the vomiting as a presenting complaint are different. When did it start? How many times have you vomited? Is it vomitus mixed with the blood, or is it just clear blood? Can you quantify it for me? Is it cupful, teaspoon, or a tablespoon? And then ask the rest of the symptoms. Anything else? Do you have anything else? And then ask the focused typical questions related to your DDs. There should be the DDs, like why the people, what could be the DDs behind the vomiting blood? It could be peptic ulcer disease. It could be varices because the patient is alcoholic, and it could be because of the medication because he's taking aspirin. So you have to ask the questions to rule out one by one. First of all, peptic ulcer disease. Ask, do you have abdominal pain? If she mentions, where is the pain? How much is it? When did it started? What kind of pain is it? Can you score this for me? Is it associated with meal intake? Because we all are aware that peptic ulcer disease, there is a pain in the abdomen and the pain is associated with meal intake time. And then ask, are you taking any medication like painkiller or any steroid? Because both of these factors are the risk factors for peptic ulcer disease. Then for the varices, because the patient is alcoholic, ask, are you passing dark stools, or have you noticed any change in the color of your stools? Do you drink alcohol? If she says yes, how much and for how long? And then ask for the, are you taking any blood thinners? What blood thinner are you taking and for how long? Then comes the red flags. What red flags are? Questions related to esophageal carcinoma and stomach cancer. So do you have difficulty swallowing? Have you noticed any weight loss? Is there any swelling on the abdomen? Have you noticed any lumps and bumps anywhere in your body? And then ask for the rest of the questions like PMMA, HO family, Desatoli, just the relevant questions. People, do not ask the extra irrelevant questions. They are not going to mark you if they see that, oh, this student is asking too much questions. No, not at all. Their criteria are totally different. Now again, you will ask the concern and do mention the examination. Examination would be abdominal, back passage, and general physical examination. Then explain. So as you have vomited blood, which can be either from the stomach or the small bowel, it could be due to the medication such as aspirin or ibuprofen, which can cause damaging to the stomach and can cause ulcers, or you have been drinking alcohol in excess for the longer period of time. This bleeding could be due to liver damage. So what we need to do is, so we need to admit you to the gastrology team. Is that okay for you? What they will do is they will do an emergency endoscopy to see the site of your bleeding. It is basically a camera test. A thin flexible tube camera the size of your little finger that would be inserted through your mouth to see the site of the bleeding. And also we will be running a few tests including routine blood test, protein profile, and abdominal ultrasound. I'll be discussing it with my senior, and we might need to start you on some medications through an IV line to stop bleeding. We will start you on IV fluids as well. Until then, do not take anything through your mouth. Patient, is it painful? Well, it shouldn't be painful, but it can be a little bit uncomfortable. Sedation is normally not needed. Patient, will I go home today? Unfortunately, not today, as we need to find the cause. That then we need to start you on proper treatment, and it will take a bit time. It is not safe for you to go home. Is there anything concerning for you? So you have to ask if the patient wants to go home, why he wants to go home. If he put some problem forward in front of you, you have to give him some solution. For example, he might be concerned about his kids. He might be concerned about his dependents, like anyone, any kind of dependent. So you have to accommodate them. Then ask, do you want to ask anything? And then say, wish you a speedy recovery. That's it. So people, do you have any question up till now? Because we have completed the scenarios that need to be covered in today's session. Any question? Hello, any question, people?
Hello, madam.
Yes, Clara.
Madam, yes, madam. In HIV scenario, ma'am,
Yeah.
patient is not willing to inform his partner, and if there is no option for patient notification program, in that scenario, what we can do, madam?
Sorry, why there would be no option for patient notification?
Actually, the partner must be notified regarding the patient's HIV.
Yeah. Yeah.
Right, madam. So
Yeah.
if the patient doesn't want to inform his partner, and definitely she must be aware that his partner having HIV, and patient notification program they are not mentioning in the exam. In that scenario, what we do, madam? We should inform ourselves, or
okay. So the thing that I got from your question is actually you need to you want to ask that if they don't give the option of patient notification program, Clara, they are not going to
yes,
any such kind of clues or points in your, for example,
okay,
STEM. So these are all
Mhm.
information that must be in your mind. They are not going
Okay.
to guide you or give you that you can mention this or you cannot mention this. They are not going to give you anything like that. They will just give
Okay.
you a scenario that you are sitting in
Okay.
this situation, in this scenario.
Okay.
Patient of
Okay.
this category has come, and now it
Okay.
concerns. Okay. So
Okay, ma'am.
that won't be the case anyway. You can always
Okay, ma'am.
mention patient notification program if you have mentioned that. For example, John, what we can do is we can get help from the patient notification program to inform your wife. If he says no, not at all, doctor, I won't allow you to do this, then you can say, like, make a sentence that, first of all, I can understand that you are very concerned about your relationship. I can totally understand that that this condition is very difficult for you, but here is a thing. Your wife's health is a priority, and being the medical professional, this is our responsibility, that even if you do not allow us, or even if you don't inform your wife on your own, we need to inform her in any case. So that is
Yes, ma'am.
obligation. So, Clara,
Yes, ma'am.
you have to keep this in mind, that first of all, you have to convince the patient that do this on your own. If he can't,
Okay, ma'am.
offer him that you can do this by using patient notification program. Even still he says, no, I won't do this, I won't allow even you to do this, then say, I'm really sorry, but we have to do this because this is our responsibility. Okay, Clara?
Yes, madam.
I hope I
Yes,
have
ma'am.
made this point clear
This
to
is the
you.
ethical. Yes, madam. This is the
Yeah,
ethical way of.
yeah.
Okay, madam. Thank you, madam.
You're
Great,
welcome,
madam.
Clara. Welcome. Anybody else wants to ask anything, people? Okay, so I believe I have made everything clear to you. Please keep one thing in mind. PLAB-2 exam is not difficult at all. Trust me, it is not difficult exam. If the people are saying you that this exam is too much difficult, there are a lot of things to cover, there are a lot of things to mention, there are a lot of things you need to mention during your conversation with the patient, that all are lies, big lies. Nobody tells you that it's a simple exam. What you need to do is you need to prove yourself to be a safe doctor in front of the examiner. They won't expect you to know all the things. They expect you to know at least the basics, that you prove yourself that you are a safe doctor. You know when you need to, involve your seniors. You know when you need to refer the patient. Are you supposed to refer the patient on immediate basis, or on urgent basis, or on routine basis? So just clear your concepts, read your notes. Once you completed the notes, start doing practicing properly. Okay. So, and be confident, people. The confidence play a vital role in.
Yes, ma'am. Ma'am, there are almost nearly 470 scenarios, right, ma'am? And in all the scenarios, sorry, madam.
Sorry.
Ma'am, almost 470 cases scenarios are there in PLAB-2, nearly. And in all the scenarios, we must know something about the treatment part, right, ma'am?
Yes, definitely.
Or in all the cases, we cannot say suspecting some. We must be aware that the diagnosis nearly should be closer to the patient's condition, and the treatment almost at least 70% we have to be aware of what to answer.
Okay. So you have the same thing that I am trying to convince to convey you to the I might be using some different, or I might not be able to convey this thing to you. Well, what I say is you have to prove yourself a safe doctor, FY2 level doctor. But FY2 level doctor is supposed to, he knows the basic things, like all the basic things. He knows when the patient, for example, increased urination, he might be a case of diabetes. So what he going to do is, he knows that this investigation is need to be performed, and this treatment might we need to start, and this way patient needs to be referred. So just know the basic. What I want to say is, do not mention all the points that are actually irrelevant. You are just to know the basics, like basically on the FY2 levels, or on the being a safe doctor, the topics that the PLAB-2 scenarios are covering, these all the basic topics. So you just have to have a basic knowledge, like at what presenting symptom the patient, the DD would be what, and what DD, what symptoms, for example, and what investigations you are going to perform, and when you are going to refer the patient. Okay, and what treatment they like to start, not too much detail. By too much detail, I means that people try to cover each and everything. For example, if they have 4 DDs, and for all the DDs, for example, they have 5 to 6 questions in mind for each DD, and they will try to ask all the questions, like each and every question. And when they come to the management part, they will explain each and everything about the management part, like this treatment for this period of time, then this treatment for this period of time, then this surgery for this period of time, and then I'm going to start you on ABCD medicine which work like this. These details are not required. Just main I have mentioned that, for example, even you are going to mention that we're going to start you on the treatment, if even if Clara, there is no need to mention the name of the drug, because think like you are actually dealing with the real patient, and patient might not be aware of that what is ACE inhibitor. For example, if you say that I'm going to start you an ACE inhibitor and it will work to control your blood pressure, even if I miss the part ACE inhibitor, that would be fine. You can just mention that I'm going to start you on a medicine that will control your blood pressure properly, and there are few side effects associated with it. That's it. If you mention that I'm going to start on the beta blocker and then the ACE inhibitor and then the atorvastatin, which is a statin, so this would be considered as the too much details. But yes, in a few scenarios, for example, in the today's scenario, when you have to mention clarithromycin, why? Because you have to explain that you are allergic to penicillin, so I'm going to start you on another which is not going to cause you any kind of allergic reaction, that is clarithromycin, and for this you have to stop the other medicine. So I think, Clara, I have made myself clear. But again,
Yes,
PLAB-2 exam is not difficult. To pass the exam, what you have to do is just read the points clearly. If there is something, causing you difficulty, and for example, especially in the management part, you can just go to the NHS site, just type the topic, and you can even read that part from here. And the management is very easy there on the NHS site. Okay, and practice properly, and that's it. PLAB is not difficult. It is not.
Thank you, madam. Thank you so much, madam.
You're welcome. Okay, so people, this is the end of our today's session. For tomorrow, Dr. Junaid will cover the rest of the session, and I think tomorrow would be our last class, and afterwards we will start doing practice, inshallah, with proper feedback sessions. And good luck, people, and let me know if you have any query. I'm available for you people 24/7. Good luck. Bye-bye. Okay, so you're welcome, Barbara. Bye-bye.